Hello and welcome. For some quick context setting, we're here to discuss a new health equity resource, a blueprint for changemakers, achieving health equity through law and policy that ChangeLab Solutions released this morning, and we're really excited about it. We read through all of your registration surveys on how you're working on equity or health equity, and we're so impressed by the breadth of change you are individually and collectively advancing. This guide is broken into 5 sections and includes value statements that outline ChangeLab's core beliefs in advancing health equity. I'm going to briefly walk you through the document, highlighting some high-level takeaways. Then we'll hear from some of our contributors on what makes this document different and how it can be used across sectors. We'll end with time for questions. So with that, please enter any questions you have in the chat box on the screen throughout the webinar, and we'll do our very best to get through as many as possible. To put a face with the voice, my name is Changemakers Wusu, and I'm the Senior Vice President for Innovation and Impact here at ChangeLab Solutions. For any of you who are new to our organization, ChangeLab Solutions works across the nation to advance equitable laws and policies that ensures healthy lives for all. We prioritize communities whose residents are at the highest risk for poor health. We are an interdisciplinary team of lawyers, planners, policy analysts, and more that works with neighborhoods, cities, and states across the country to create thriving communities. For more than 20 years, our ChangeLab team has been working alongside communities to help them create lasting changes that will help all residents live a healthy life. We know many places are working to achieve equitable outcomes, but are struggling with how to do it. A blueprint for changemakers is the how-to guide that answers this question. It is grounded in our work to help residents and policymakers develop and advance homegrown solutions that reflect their lived experiences and are designed to create healthy, equitable communities. It is a guide to educate decision makers, practitioners, communities, and other change makers about legal and policy strategies that benefit children, their families, and the communities where they live. This resource was developed in partnership with the Robert Wood Johnson Foundation and a national committee of advisors representing diverse communities and sectors. So, why health equities? What are health equities and why do they exist? Our value statement number 1, we believe in the power of healthy communities. Where we live and the opportunities available to us have a big impact on our health and well-being. Communities of color, low-income communities, and other marginalized groups are disproportionately affected by discriminatory practices and policies, which can lead to poor health. Health inequities are deeply entrenched and they are growing. Policies and practices at every level have created these barriers to good health, and we need to work together to alter the systems that keep inequity in place. Shrinking the gaps in health outcomes differ from trying to improve public health overall. It's a complex objective that requires new thinking and new strategies for action. Specifically, rather than focusing on reducing the prevalence of any single disease, the challenge is finding ways to change the distribution of healthy environments, economic resources, and opportunities. Finding such solutions requires a fundamental shift in how policy is used to promote health. These 5 drivers, fundamental drivers that you see before you, structural discrimination, income inequality and poverty, disparities in opportunity, disparities in political power, and governance that limits meaningful participation are the forces that create health disparities. Our second value that I'd like to highlight is that we acknowledge and learn from past actions. Achieving health equity requires the use of law and policy to create long-term change in the forces that created the health disparities. And some of those forces are the 5 fundamental drivers that I just referenced. Law and policy have been central to creating today's health disparities. They've made resources scarce for many and created unhealthy environments, especially in cash-strapped communities and communities of color. Yet those very same law and policies can be used as tools and should be used to create positive change. I'd like to speak to you a bit about the power of local solutions. Local policy change is more likely to be grounded in a deep understanding of health needs, community goals, and lived experiences of residents, and therefore more likely to create the kind of lasting change that comes from responding to local priorities. When leaders make public health decisions without considering local context, concerns, or contributions, those decisions may miss the mark or even exacerbate health disparities. Local governments are often laboratories for policy change. As part of a long-term strategy for achieving health equity, local changes can provide case studies and evidence of success, which can set the stage for state or national changes in the future. Local policy change may be more feasible than policy change at the state or federal level. Local actions don't happen in a vacuum either. Federal and state laws influence or control local discretion in decision-making. In addition, the 5 drivers of health and equity are created and influenced by the laws and policies enacted by the federal government, each state, and many thousands of regional and local governments. To be effective in shaping local policy, changemakers need to understand the factors that shape what is legally possible in their communities. And given that the authority of local government derives from power delegated by higher levels of government, changemakers have to think about how power, authority, and funding are controlled and delegated between levels of government. Value 3, we strive for significant, sustainable, and equitable health improvements. By focusing on the fundamental drivers of health and equity mentioned earlier, communities can develop a comprehensive set of strategies to guide their efforts to achieve health equity. In the blueprint, you will find a list of evidence-based strategies that address the fundamental drivers of health and equity and can be implemented through local laws and policies. Changemakers can use the strategies as a starting point in developing a local agenda for change to advance health equity. There are also policy menus that highlight how various policies interact with fundamental drivers. Take this first one here, building a movement for health equity. These are some policies that advance civil rights, safeguard equal protection under the law, and expand political participation. Our next menu is about accessing health care, and these policies and programs, some of which are federally funded programs in which state and local governments shape eligibility criteria and implementation. These are policies that influence how the fundamental drivers of health and equity shape places and access to resources for health, safety, and well-being. And these policies ensure that every child has a fair start in life and provide social protections and supports for families. Finally, these set of policies promote equitable opportunities for employment, entrepreneurship, and stable income. I will also mention that ChangeLab Solutions has additional resources, fact sheets, model legislation, webinars, and the like that explore many of these policies that the blueprint links out to. And finally, value number 4, we strive to be aspirational, inclusive, and collaborative. Efforts should be grounded in 4 guiding principles that can help inform new laws and policies intended to spur equitable outcomes. They are engage community members. The process of changing laws and policies to create healthy, equitable communities must put the people who will be most affected at the center. We want to build capacities. Communities must take the steps to generate the capital, expertise, and commitment needed to do the work. Understand the root of the problem. Begin by acquiring a shared understanding of local problems as well as systemic issues that are causing those problems. And then finally, align action to solve core community problems. This approach helps prevent resources from being stretched too thin, pools capital for priority actions, and ensures that identified issues are addressed from as many directions as possible. So it's with that that I am really pleased and excited to turn it over to our great panel of speakers today. And we're going to start with Monica Vinluan, who's a Senior Program Officer with the Robert Wood Johnson Foundation. Through her work at the Foundation, she strives to ensure that all children in the United States have a healthy start. Monica, can you tell us a bit about how this blueprint aligns with the Foundation's priorities and how it's different from other health equity tools?
Thank you, Shaniqua. I'm delighted to be joining you all on this conversation today. We at RWJF have been working with ChangeLab Solutions for more than a decade. We really rely on them to develop and design effective tools and resources to help catalyze policy change. We appreciate the high quality of the work, their intentional focus to address equity, and their ability to translate complex legal theories into action. Above all, we have confidence in their ability to gauge the needs of communities and truly listen to what advocates and changemakers say they need. Now, we all know that Maris Ash has been a thought leader and a leading-edge thinker for decades. Our field would not be where it is today without her. And the work that we all seek to do together to advance and achieve equity, utilizing the tools of law and policy as a lever, would not be possible without ChangeLab Solutions and their amazing team. As my colleague Shaniqua said earlier, they have heard the call and the desire to help advocates operationalize equity into their work. So this blueprint doesn't just answer the important question of why focus on equity, but it offers the answers to the seminal question of how to operationalize equity. Now, for us at RWJF, we believe that health equity means that everyone in America has a fair and just opportunity to be healthy. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and the lack of access to good jobs with fair pay, quality education and housing, safe environments, and health care. And what's amazing is that the blueprint guides users through these obstacles and helps them find solutions. We are truly delighted to be on this journey with ChangeLab Solutions, and we can't wait to hear what you all think about the blueprint.
Thank you, Monica. So it takes sectors working together, entities working together, and I think what Monica has highlighted is the role of partnership as well. And so I want to also connect to other partners that we worked with to develop this guide. We worked with the National Committee of Advisors that represented various geographies and sectors. Our National Committee of Advisors was chaired by Dr. Joe Ivy Buford, who is currently the president of the International Society for Urban Health and a clinical professor of global public health at New York University. And with that, I will also add that Dr. Buford has served at every level of government and is a key icon spreading good health, good work across the public health sector and beyond. It is with that that I will turn it over to Dr. Buford.
Thanks very much, Shaniqua. That's very kind. Let me just say what an honor it has been to chair this fantastic advisory committee, and also, before going into the charge to the committee, just to say how impressed we all were with the openness of the ChangeLab staff and leadership to the input of the committee and to lots of redrafts and modifications that came out, we hope, with something that will be incredibly useful to you. The charge to our committee was first to bring a cross-sectoral, multidisciplinary lens to really join in the thought partnership with the staff of ChangeLabs. And we had a very diverse committee representing medicine, public health, law, community-based organizations and advocacy groups, many connected to indigenous communities, concerned about community voices in the democratic process, community economic development, and children and family well-being. We also had representatives from foundations and social work and planning. So the diversity of the committee really, I think, complemented the diverse skills within ChangeLabs. The other three charges to us were really looking at promising laws, policies, and practices, and tools and resources that we were aware of that really advanced health equity. Sharing examples and success stories from communities, and there was a big emphasis that evidence-based data comes from research and evaluation, but it also comes from lived experience, and the importance of those on our advisory committee and the sensitivity of the staff of ChangeLabs to that lived experience was very evident throughout our deliberations. And finally, providing guidance and review and feedback on the various drafts of the blueprint, which we were not shy in doing, and again, kudos to the staff and the leadership of ChangeLabs for their responsiveness and a process that I think for all of us was a real delight.
Law and policy starts with Changemakers, much of what Dr. Buford highlighted. That the evidence base is important, but also the lived experience. And so I would like to turn it over to our colleague, Michellene Davis, who is the Executive Vice President and Chief Corporate Officer at RWJ-Barnabas Health. She served as one of the advisors on the committee, and at Barnabas, she oversees the social impact and community investment practice, and they're doing all kinds of amazing work in the city of Newark and throughout the state of New Jersey. Michellene, I will turn it over to you.
Thank you so much, Shaniqua. And thank you so much for the opportunity to really have worked on the advisory for the blueprint. I think that it is a game changer for Changemakers. And I think that talking a little bit about how our partnership began will help to evidence that. So I'd like to back up for a moment just to create a picture for our listeners and our participants around RWJ-Barnabas Health. It is the largest integrated, most comprehensive healthcare system in the state of New Jersey. We are a unique system of both urban and suburban hospitals, and as a result thereof presents a very interesting opportunity to do some non-traditional work. When I say non-traditional work, I'm merely talking about the fact that, as so many of our participants know, in today's webinar, nonprofit hospitals are required to participate in something called community benefit. Social impact is not just that work. I think, at least for hospitals in my state, that shows up in a variety of things and ways, ranging from something that we call charity care, literally to individuals who screen at healthcare fairs. But I think that our social impact work was really our avenue of going farther and deeper alongside and with our communities in order to make long-term sustainable change in systems and structures that affect really the root cause of so much of the inequity that we see in healthcare, and really that which contributes to healthcare disparities in those outcomes. We were delighted to have an opportunity in beginning our going into this space to really work with ChangeLabs in a very interesting way through our work with our Greater Newark Community Advisory Board, which is a advisory board of local individuals who range from the local school nurse to literally individuals who live in the community to policymakers, both at the local municipal level. So the president of the local municipal council is on this advisory board, as well as the state senator for that particular district, clergy, law enforcement, and others in between. We were able to work with them in a very dynamic manner to take a look at the information and the data which came from our hospital's community health needs assessment in order to figure out whether or not the data that we were seeing in our ER and by virtue of our health needs assessment really was the same as the felt need within that community. As a result of that, we were able to realized that the issue of hypertension and obesity and other incidents that were very high in the patient population, that when we boiled it down to this community within the South Ward of Newark, New Jersey's largest city, what we were able to evidence and see really was the fact that we remained to be in a food desert. And quite frankly, that those new food outlets that were generated were really contributing to an environment which was becoming a food swamp. So there became an opportunity and access to more food that lacked healthy, nutritious options. Well, I will tell you that in partnership with ChangeLabs, not only were we able to go about the business of trying to educate our community members around how and why this contributes to these negative health outcomes, these poor health outcomes, this high rate of hypertension and stroke and diabetes and obesity, but quite frankly, we were also given an opportunity to hear from them about the way in which they wanted to address it. What came out of that was twofold. One was a food insecurity documentary, which was really led by our youth. We were able to work with youth journalists in order to create an opportunity for them to better understand how systems and structures have contributed to, through a framework of laws and policies, the fact that their environment really became first a food desert, and then what was going on, what was happening while they were alive, that they were able to see was contributing now to the growth of a food swamp. We then armed and equipped them with an opportunity to interview their policy decision makers and to really document that. But this work, our partnership with ChangeLabs, went so much farther even than that, in that it really gave us an opportunity to broaden and to deepen in working in concert with our community through a method of co-design, an opportunity for them to best understand what policies, laws, and regulations they would need to have implemented on a local level in order to change the communities that they lived in. A really important aspect of all of this. And I will tell you that what we saw was the kind of thing that really we can tell will go forward for future generations. And that is that, yes, we of course worked with the youth and also the clergy. We created an opportunity to provide for them what has worked in other municipalities and other jurisdictions across the country. ChangeLabs was best able to provide them with a sense of an understanding of what access and opportunity could very well look like, and then, quite frankly, outlined for them the ways in which each one of them could be armed and tasked with bringing about that change. I will tell you that the blueprint to me really is the best path forward in being able to take that modeled experience and to really fashion it along the lines of any particular local community, along with, and I really believe, with community at the forefront, in order to better equip our community members as well as our hospitals and our health systems with the way in which community collaboration can truly contribute to creating a more equitable future. That is what we were able to do in that municipality, in that locality, and what I believe that the blueprint gives us an opportunity to do through properly investing in not just our capacity building, but really the access and opportunity that is necessary for advocacy.
Thank you so much, Michellene. I'm going to go a little bit out of order and come back to Dr. Buford to pose one more question before we go over to our Q&A panel. Looks like we have a little time. Dr. Buford, can you share some of your perspective on how this tool can be used by the public health field and government?
Yeah, thanks very much for the question. I think it's a really important time, and it couldn't be a better one. Sort of broader public health professionals, and as you just heard from Ms. Davis, I think the healthcare delivery, health systems community are really looking at three kind of trends and sort of catching up and engaging seriously with them. The first is trying to improve conditions in communities that allow people to be as healthy as they can be. So government's role is to try and guarantee those conditions. And I think when we look at the differences within cities, within communities, we see the inequities that we've been talking about on this panel, and which this tool is really trying to help people address. The second theme is this one of partnerships, which has come up from the beginning of the conversation. And again, I think in public health and in government, we're beginning to recognize, and in healthcare as well, we're beginning to recognize that we can't do everything alone. We have to work with other people effectively, and that certainly the determinants of health are much broader than the ability to provide important medical care in a high quality way. They're very complementary. And finally, we also are seeing the real importance of political commitment in making change. In cities and states and countries, looking really at the ability to bring together different sectors, which is something that mayors and governors and sometimes heads of state can do, to get them to really tackle the decisions that are made in each sector, which can promote health or undermine health. For example, transportation is a good one. If we do mass transit versus cars, we have a very different health impact in that decision. So I think what the blueprint does is really add an important knowledge base and experience, evidence-based experience base to a better understanding of the regulatory and legal opportunities that may be available in communities but have not really been part of this broader set of thinking. And it's a very exciting time, and I think the challenge, as you've said earlier, is to really have individuals and in local communities adapt and take from these terrific menus to use them in their local situations and to influence their local policymakers, elected officials, and thought leaders.
Thank you very much, Dr. Buford. So listeners, we've heard from philanthropy, we've heard from health system and the work that they're doing together with their community, and we've heard what policymakers and public health professionals can do. And so it's with that I would like to introduce our Q&A panel, and I'm so excited and super I say this with such great humility because I get to work with all of these people every single day. And so without further ado, I'd like to introduce some of the masterminds behind this guide. Erik Calloway is a senior planner at ChangeLab Solutions. He focuses on the links between the built environment, equity, and health, as well as develops strategies and tools to help communities support healthy living and sustainability. Kim Libman is a program director here at the lab and oversees application of the public health evidence base to strategies, innovations, and tools. She also leads the organization's food policy portfolio. And Aysha Pamukcu is the health lead for ChangeLab Solutions. She oversees our health equity strategy, innovation, and implementation. She focuses on law and policy solutions that help close the gap in unjust health disparities. If you have any questions about what we've shared in this presentation or the document broadly, or questions even for our previous speaker panel, please enter them in the chat box now, and we'll do our very best to get to them. While you have a minute to do that, I am going to throw out the first question and get our session started. Aysha, Kim, and Erik, can you share the key things that people need to know about this document? Erik, let's start with you.
Great, thank you. So I want to start by having everybody take a quick second to picture a child you know today. Think about how they'll experience their community, for example, over the next 20 years of their lives. Over that time, they'll require a variety of services, and their community will undergo many changes. And those services and changes could help or hurt their ability to lead prosperous and healthy lives. Now, local government staff are responsible for a wide range of laws and policies that determine where those services are delivered and how communities will change over time. and who benefits from those services and changes. From affordable housing preservation, protection, and expansion to the density of alcohol, tobacco, and sugary drink retailers. From dropout prevention to transit-accessible jobs that provide paid family leave, and everything in between, local policy provides many opportunities to make tangible, place-based changes that touch people directly. And local change makers have the power to make sure that those policies support health and reduce health disparities. Now, the blueprint highlights 3 approaches to accomplishing this goal. Community engagement that ensures inclusive, people-centered community participation in the policy process. Number 2, building capacity for multi-sector collaboration, capital, expertise, and commitment to do this work. And finally, integrating equity into law and policy language in order to take action on the fundamental drivers of inequity so that those actions create lasting change. Now, eliminating health disparities may seem daunting, and addressing fundamental drivers of inequity, such as structural discrimination or poverty, may feel even harder, but it is possible through collective action on law and policy change at the local level. And I hope the blueprint gives you inspiration and guidance about how to do that in your community.
Thank you, Erik. Kim, can you share what are the key things that people need to know about this document from your perspective?
I would be glad to. Thanks, Shaniqua. So I think the 3 key things that people should know are that overall, public health has made some strong progress in helping to save lives, but it really hasn't done enough over the past few decades to close gaps in disease and death rates between groups. And this guide is important because it provides tools specifically for closing these gaps. Number 2, this guide is drawing on a wide range of new theories and evidence that focus on health equity, not just on population and public health. So as mentioned earlier by Dr. Buford about the diversity of our advisory committee and the way we expanded the evidence base that we use to include not just peer-reviewed studies, but case studies and I hesitate to use the word anecdotal, but lived experience from our organization and experts that we consulted with. We use that evidence as well as drawing on systems theory, trauma-informed practice, studies of social welfare and policy, legal theory, and even global health. And we translated insights from all these different perspectives into a user-friendly guide, again, that specifically focuses on closing health gaps in the United States. And then number 3, I think it's important to mention that this guide goes very far upstream with our 5 structural drivers of health equity, and we provide practical examples for how to strategically use local policy to address those drivers. So we've heard a lot in public health about policy systems and environment change over the past decade, and I think one of the things that I'm most proud of with this document is that we try and go a level beyond that with the structural drivers and really try and give people tools, as Erik said, to tackle very complex problems in a very practical way.
Thank you, Kim. And Aysha, what are the key points that people need to know from your perspective about the blueprint and how it can support their work?
Thanks so much, Shaniqua. I think where I would like to leave folks as an attorney at ChangeLab is that given the interconnected nature of the fundamental drivers, which the visuals did a really great job of laying out, we've seen the public health field increasingly looking towards interdisciplinary solutions. Erik ended with a call to collective action on law and policy change at the local level. Kim talked about a whole bunch of additional strategies like systems theory and trauma-informed practice. And I'd like to leave us with a note about the connection between law and health equity. So the blueprint identifies 3 key legal strategies, and I'll revisit them here briefly: legal integrity, innovation, and intervention. I'd like to highlight one promising avenue of legal innovation, which is the interdisciplinary blending of civil rights law and public health. This is something that we're currently calling the civil rights of health. In the blueprint, it identifies structural discrimination as a fundamental driver of health equity. We've seen historically that civil rights law has been a really powerful remedy for long-standing structural discrimination. But the problem is, in recent years, civil rights tools have become less effective as discrimination has morphed from something like individual bad actors to harms that are bigger and harder to prove. If we just think about the new science on implicit bias or what we've heard today about unequal power and unjust systems, it's really clear that modern day structural discrimination has changed into something very different than what it used to look like. And we've seen the field of public health in parallel continuing to grapple with health inequities, as Kim said, that are not just resistant to change, but are actually deepening and gaps that are widening. So this is where a partnership between the two disciplines, civil rights law and public health, can positively transform both. If we start to understand health as a matter of justice and civil rights law as a health intervention, that can strengthen public health advocacy. And then simultaneously, if we understand social injustice as a health issue, not just a moral or legal issue, as we attorneys have been doing, that has the potential to reinvigorate civil rights advocacy to go beyond its current limitations. So I leave us all with that just as a note for what some of these interdisciplinary partnerships could look like, and one that we're currently working on and very excited about at ChangeLab.
Wonderful. Thank you, colleagues. And so now I see that we have a lot of questions. Very exciting. So I'll get us started by posing the first one from participants. How can you deal with policies that are meant to protect public health? However, some may have unintended consequences. How do you find a balance, such as with criminalization, as well as finding tenants that are really poor? How about we start with you, Aysha, to start us off with answering these questions?
Yeah, thanks for that question to whoever posed it. It's certainly very timely. We've been seeing the field talking more and more about problems not just in passing equitable laws and policy, but in equitable implementation. So what happens after a very well-intended policy is put into place, and how does that impact people on the ground, which connects back to the idea of how are we connecting policy to people's lived experience. And I think in terms of unintended consequences, especially if we're looking at equitable policy implementation, and this won't be a surprise to anyone who works in this space, there's not a black and white, easy-cut answer to it, but I think it's rather about helping educate folks about the different trade-offs they make when they make different decisions and how they decide to write, enforce, and implement policy. If we want to see where that can go south and how it can hurt communities, I think we need look no further than the example of Ferguson, where inequitable fines stemming from inequitable policies impacted the health and wealth of the community in Ferguson, which was predominantly black and had many low-income folks and families. So what I would say to the question of unintended consequences is we have to start by leading with our values and using our values as the foundation to figure out how do we operationalize a commitment to those values, and then help our decision makers make educated choices about the trade-offs inherent in the different policy decisions. And that education should be informed by community knowledge, lived experience, and the best health and evidence base.
Thank you, Aysha. Our next question is, do you have any suggestions as to how to connect with rural communities who are implementing healthy and equitable local policies? In my research, it has been hard to locate a rural community because A, they may not have traditional governance or may have an incorporated town. Erik, how about you take this question?
Sure. I think one of the things with rural communities, especially without governance structures, is that they do tend to have fairly strong social networks. So tapping into those social networks can be a very effective way of disseminating information, identifying problems that need to be resolved, and taking kind of really grassroots community level action on the types of issues that we're talking about. And then otherwise, we do have a variety of resources on our website, some community profiles around work in nutrition and physical activity in schools, and some some of our resources that are specifically focused on rural implementing, like safe routes to school or various other types of policies in the rural setting that I would point you to in order to get some more information if you're looking for specific kind of topical policy interventions in the rural setting.
Thank you, Erik. Our next question is, does the blueprint incorporate or use ACE data? For those on the phone who don't know what ACEs are, it's Adverse Childhood Experience. Kim, how about you start us off here?
Thanks, Shaniqua. So looking at information about adverse childhood experiences is definitely part of what we're talking about when we mention the use of trauma-informed practice or trauma-informed theory is one of the things that guided the development of the guide. We don't cite any specific data about levels of early childhood trauma or I think mention particular trauma interventions, but I will say that the menu of policy options in the back also it includes information about how to create child-friendly schools and disciplinary systems that are not re-traumatizing to children. And a lot of our perspective that Erik has been talking about in terms of drawing on lived experience is one way of making sure that you are not re-traumatizing people in the process of creating political change and developing local strategies.
And if I can jump in on that one also. I think that one of the benefits of addressing the structural drivers is that addressing those structural drivers in and of themselves will help reduce adverse childhood experiences because the types of environments that we're talking about when we talk about health from all perspectives, not just physical health, but the environments, if you think about the way that stressful or unsafe or unhealthy environments can cause or increase the risk of the types of experiences that children can have, either because of stress on parents or families or stress as a child in the school environment, that these are ways that these structural driver approaches are ways to help reduce those experiences among children.
Thank you, Erik. This next question I am going to pose to the entire panel. In my community of the South Bronx, we are in a precarious time when we see gentrification moving in while the community continues to struggle to gain access to necessary services like fresh food, health services, and access to safe spaces for living. Is it possible to create structures for change that encourage continued progress of our community and inviting in the economic and social advantages of gentrification while preserving the cultural representativeness of our community and set the foundation for equitable change? Erik, would you like to start us off?
Sure. That is most certainly a very complicated and difficult question, and is really fundamental to the types of issues that we're trying to address here. I would say to start with the people-centered approach that we mention, which is really fundamental to answering this question. Inclusive community engagement where a representative cross-section of the communities where you're making law and policy change or where you're doing interventions is really necessary so that everybody is contributing to the decisions about what actions are being taken and ideas about how to address those types of concerns. So when you talk about what is the culture of the community, everybody in the community needs to be at the table in order to define what that is so that you can then take steps in order to make sure that investment in the community doesn't undermine or kind of push out those definitions of what the culture is. And then secondly, I think that it's really important that we collectively do a better job of insisting on and being proactive about instituting policies that are intentionally about avoiding displacement specifically. So gentrification and displacement being slightly different, but especially about avoiding displacement to make sure that community investments don't push out the residents of that live in those communities now by making it too expensive for them to live in terms of housing or food or any other services that are available in those communities.
Kim and Aysha, do you have any points to add?
Hi, this is Kim. I would just add that there are some exciting tools that exist that are specifically geared toward highlighting health in community change and development processes, like health impact assessments. And some of the folks involved in this webinar formerly worked on a project in East Harlem to develop a health impact assessment related to the rezoning there, which I would point to as a local to the South Bronx kind of example of a specific tool, that being health impact assessment, that can be used to integrate community perspectives with health evidence toward the goal of influencing local development.
Hi, Shaniqua. This is Jo Buford. I just want to jump onto Kim's comment again about East Harlem, but being a New Yorker also around the South Bronx. I think there's a lot of local pride in many, many communities, and we've talked about the issue of getting multiple stakeholders around the table and kind of building on existing organizations, existing networks, existing small, large institutions. Because I think many, this is, I'm not trying to be overly simplistic. This is a tough issue, as Erik mentioned, but I think many communities that have that identity are engaging with people coming into the community who really want to be part of that, that sense of identity. I think East Harlem, El Barrio has a very strong identity. I think people in the Bronx, in different neighborhoods in the Bronx, have strong identities. So I think just encouraging everyone to sort of really own that identity and create that network and get into these conversations. I think the receptivity and the dialogue may be more than people are imagining. At least at the human level. So just a comment to add on.
Thank you. The next question we have is, how can my community work with ChangeLab the way that Newark did? Mm-hmm. I'm going to start with Erik.
Sure. There's a variety of different ways that we can help with that kind of work. We definitely have an extensive library of model laws and policies on a whole range of topics, from healthy food systems, active transportation and physical activity, affordable housing, tobacco control, alcohol density. So a wide variety of topics that are many of which are represented in the appendix of the blueprint, and we can help communities in a number of different ways around those. So you could start by starting with one of those model policies, and we can help tailor it to your community. We can help with capacity building by running trainings with particular organizations or agencies around either on broader topics of integrating health equity into your work or around specific policy interventions. And we can also work alongside local government or institutions or alongside private consultants that are working in a community or even community organizations, advocacy organizations, to try to work through any particular policy intervention process that's ongoing. So that could be helping with community engagement, helping to audit or shape the actual policy language, and then also helping with kind of strategic implementation guides. And so that may be one-off projects, or it could be engaging in the kind of typical policy processes that communities go through every day, like comprehensive planning processes or community health needs assessments or environmental project review, those types of various typical planning and policy processes that happen at the local level.
Thank you, Erik. Our next question is, are there specific toolkits you would recommend to help grassroots organizations engage grassroots community members with authentically to actively partner in passing a local policy, such as a kids' meals ordinance? Is this blueprint one such tool to accomplish this? How about, Aysha, we have you address this question?
Absolutely. And Shaniqua, just to do a repeat back, the question was about authentic engagement with communities?
Yes.
Yeah, I think there's a lot in here about how to engage authentically in communities. I mean, especially as an attorney and as someone who works in public health, I think it's really helpful for all of us to be aware that we represent different professions, institutions, and systems that have at different times been complicit, if not directly responsible, for creating health inequities or making them worse. So, I mean, I think there's a lot in this blueprint about us as professionals owning up to the sometimes harmful legacies of our professions and institutions, and then using the tools that have historically been used to do harm as tools of healing and tools of setting to right long-standing historical justice. So I guess I would start with a first note on approaching communities with cultural humility, which is a major component of this blueprint. And I also think there's a lot in here about how to approach communities with a different narrative than they may have been approached with in the past. Two things that jump out to me in particular is approaching communities by centering their own experience and treating people as the experts in their own lives. I think that is such an important entry point to authentic engagement. And also, I think something that's really helpful with authentic community engagement is making people feel a part of something bigger than themselves, and that's this movement of movements concept that comes up in the blueprint, and helping people understand the way that their experiences, what their communities have gone through, how they fit into larger, more complex systems, and what they can do to enact change within those systems. So I think also leaving folks not just with the respect for their experiences, but also with a note of empowerment and a sense of how they fit into to a broader system. Audre Lorde said something that I really love, where there's no such thing as a single issue struggle because we don't lead single issue lives. And I think starting with those types of ideas, which are really deeply embedded in the blueprint, are a helpful foundation to build meaningful, authentic engagements with communities that may not have a high level of trust in institutions and systems.
So my next question from participants is, how do you navigate advocating for policies to be put in place that are meant to be effective for public health issues but are met with social stigma? Kim, how about we start with you here?
Sure. Can you just, the question is about policy implementation or advocacy?
I'm happy to repeat it. It's more about advocacy, but I think implementation would be helpful here. How do you navigate advocating for policies to be put in place that are meant to be effective for public health issues but are met with social stigma?
So I'm going to kind of think of a practical example to help guide my response here. And I'm going to think about mental health and substance use as issues where taking a harm reduction approach or taking an approach that may be rooted in the lived experience of folks that are dealing with those issues may be harder to advocate for because of issues around stigma. And I think one of the first things that you have to do is you have to start with the folks whose lives you are trying to influence, and I would say not just start there, but kind of keep them at the table. So if this is an advocacy effort where you're going to be engaging with policymakers, I would say that a thing to do would be to make sure that you, as the public health expert, bring those local folks with lived experience along if you're going to be doing any any public speaking or any visits with elected officials to try and lobby for actual policy change. I think often, letting people speak for themselves about why something is important can shed light for policymakers about nuances of a situation that will get beyond some of the stigma. So one of the things that I'm thinking about as a practical example would be issues around implementing breastfeeding policy for people who are substance users. It's a really tricky and gray area, and I think that I know I've seen public health experts really struggle to figure out what the best practice would be, and I think that they have come up with the most empathic and creative solutions when they actually went back to the substance users who had young children to try and think about, what would be the best way of balancing the interests of everybody involved and creating solutions that don't further stigmatize moms who are trying to do the best thing for their baby as they're in recovery. Thanks.
Hello, everybody. We're approaching the top of the hour, and so I want to close this out and be respectful of everyone's time. We still have many questions in the queue. We will follow up with each of you with written responses, and you can also visit our Contact Us page to pose more questions. And if you think of new ones after the result of this webinar, as you dig into the blueprint, please feel free to reach out to us. So now that you've heard what this document is and how it can be used, we have two asks for you. First, we want you to dive into the blueprint. Think about what change you want to see in your community or what you're already working on, and how the policy strategies in the blueprint and other resources on our website can support you in getting there. Second, we're here to support you and your work in change making. We provide legal and policy technical assistance on everything you see outlined in this blueprint and more. If you want to get started on some of this work but don't know how, or you've started and need extra support, we want you to get in touch with us. Visit the Contact Us page on our website to be connected directly with a ChangeLab Solutions staff member, and a reminder that we will be more than happy to answer any additional questions that have come up for you today. And then finally, thank you so much for joining us. It's been an absolute pleasure to share with you about our work in the release of this blueprint. We're looking to our discussion today and your feedback to tailor future trainings and resources. So as soon as we end, you'll be directed to two very quick questions. What support do you need as it relates to advancing health equity through law and policy, and how do you want to get that support? Keep in touch. Our contact information is here. Again, thank you very much, and enjoy the rest of your Tuesday.